Good morning, everyone. Today we wanted to cover the 10 different products of Microbiome Labs, and starting with the Total Gut Restoration. So just in quick review, each one of these areas are very well defined in the research, that dysbiosis will lead to chronic inflammatory diseases, lack of keystone strains will lead to chronic inflammatory diseases, and a breach of the mucin 2 barrier will lead to chronic diseases. So we know that these are the three primary areas of the gut that need to be held in place with integrity. And we know that when they are not, then all sorts of problems with the lipopolysaccharide occur, where it degrades through the layers into the lumen and causes the cascade of immune problems. This is a nice summary of all of the research that has linked LPS to problems. We see that it's linked to leptin resistance, to chronic constipation, to mood and appetite disorders, to depression, cognitive decline, loss of memory and recall, depression, anorexia nervosa, anxiety, chronic pain, Parkinson's, hypogonadism, low testosterone, and autoimmunity. So this is well documented in the research. So we see that lipopolysaccharide is a huge problem throughout the body, and we know the cause is metabolic endotoxemia, or leaky gut. We know that the clinical study that Microbiome Labs did targeted lipopolysaccharide. That was their primary concern, and they were able to demonstrate that they could reduce 45% in a spore-treated group and also prevent the 32% increase that was happening in the untreated group. They also started independent research project on the other indicators that were improved, such as triglycerides, ghrelin, MCP1, several of the different interleukins. So they have several autoimmune disease clinical trials in place, as well as weight loss and lipids. And then the second phase of this research was a 90-day, where other indicators came into significance, and they are also now independent studies. Another human clinical trial, or another study that was published, was using the SHIME study. And the SHIME, we'll talk about in a moment, is the premier way to test probiotics and how they perform. And this particular study was looking at the symbiotic relationship between the Megaspore probiotic and the Megaspore, or the Mega prebiotic, and showed that there was a consistent enhancement of the metabolic activity of the gut microbiome. This is the SHIME study, where, again, each section of the gastrointestinal tract is studied so that you can see how a probiotic performs. And in this particular symbiotic study, it showed that the spores plus the prebiotic performed synergistically, or they promoted each other. So we've looked in previous discussions about how the three products work together in the total gut restoration to help with metabolic endotoxemia. But now we're going to look at another publication, and that was with just the one spore, Bacillus subtilis, in the product HU58. And we see that it was very significant in reducing inflammation, and it has several markers here that were highly significant, 45 and 55%. This product is also excellent in the use of hepatic encephalopathy and the reduction of ammonia. and the increase of neurotransmitters, serotonin and dopamine. Another SHIME study publication, and this was also quite recent, and it showed the bacillus spores as a treatment for IBS. And you'll see they compared it to rifaximin and showed that it scored better than the pharmaceutical. So that's a very positive study there, which we should expect when spores are healing metabolic endotoxemia. Another product that's very helpful is the 2-spore product in RestoreFlor. You see it contains the Bacillus subtis as the HU58, but it also contains Bacillus clausii and Saccharomyces boulardii. And this is a very helpful product when you don't really have the time to titrate, such as when you're using the MegaSpore probiotic. And it's very helpful when you're using with a either natural or a pharmaceutical antibiotic, because it's more conservative, has fewer spores. It has the Saccharomyces boulardii, which is going to work against the candida, which is the usual side effect of an antibiotic. It also helps in SIBO, diarrhea, and UTIs. Another product that Microbiome Labs launched not too long ago was MegaMycoBalance. And this is an undecanoic acid and B-propolis product, which is very helpful with candida. And you'll see that its primary action is to stop this hypha attachment from the candida to the epithelial cells of the gut. Because you can see the damage that it does in causing the destruction of the tight junctions and increases the leaky gut as well. And you can see the studies here of how antifungal this undecanoic acid is to the candida. Then another product that was launched recently is MegaGuard. This is for upper digestive tract disorders such as GERD, dyspepsia, H. pylori, and sluggish bile flow. You see that the artichoke leaf is the primary constituent that helps stimulate the bile production and helps with cholesterol levels. The licorice flavonoids helps decrease the H. pylori levels. And the ginger root helps with the acceleration of gastric emptying and soothes with nausea. And this product has been very helpful with secondary bile salt diarrhea, which is usually in the form of a chronic diarrhea. And then the most recent product that was launched is Wheat Rescue. You'll see that it has also a couple of the different spores and Saccharomyces boulardii. It also has an enzyme blend that's going to be digesting the wheat proteins so that they're non-immunoreactive in the gut, so that you won't have that inflammatory response. This is very helpful in those individuals that are trying to have a gluten-free diet. And then this is an important diagram that's showing how vitamin K2 works in the body, specifically in building bone. So we know that vitamin D is activated, it mobilizes calcium and has a release of osteocalcin, but without vitamin K2, you cannot carboxylize your osteocalcin. So this step is extremely important to put your osteocalcin into the active ionized phase in order to enter the bone. And you can see here it also helps with resorption of bone. And so again, vitamin K2 needs to be there. If it's not, then this uncarboxylized osteocalcin moves into the soft tissue and causes atherosclerosis, kidney stones, gallstones, and plaquing in the brain and arteries. So our solution to that problem is a high dose Megaquinone, and we have it in 2 different forms, and we'll show a comparison here. Of course, both the active ingredient is the MK2. So both of our formulas are going to help remove calcium from the tissues and arteries, halt the mineral density loss, protect the brain and nerve, and reactivate oxygen species, and induce apoptosis in vitro leukemic cells, reduce the risk of prostate and liver cancers, improve insulin sensitivity after 4 weeks of supplementation, and enhance male fertility by increasing testosterone. Because again, the vitamin K2 is a quinone, and this is very helpful in mitochondria. So you'll see the energy systems throughout the body increased. And MyoMax is going to do each of those things. And here you see that our study, human clinical trial, was done on the MyoMax product, demonstrating that it's the vitamin K2 that is showing these beneficial results in cardiac output. And they were able to demonstrate that you can increase cardiac output by 19% and blood volume, which is very important for anybody that moves, of course, and for competitive athletes specifically. So here's the side-by-side comparison. You'll see there's slightly more of the MK2 in the Megaquinone. It also has K1 to stop the reaction of K1 converting, K2 converting to K1 in a deficiency situation. It also has some absorption minerals, magnesium and zinc. So this would be, the MyoMax would be ideal if you have someone on blood thinners or is taking multiple vitamins, so that you don't reach or overreach on the milligram amounts of the magnesium and zinc. And you can see many of our clinical trials are being performed at prestigious universities and centers. And that concludes our presentation. So I'm going to go ahead and open the floor. Kevin, do you have any questions? Oh, hey, we've got another participant there. How are you doing? There you are. Were you able to catch the presentation there? Make sure you're...
Only the last, like, maybe 5 minutes. I was a little late.
Okay, well, I do have it recorded, so I will send that to you.
Oh, great.
The purpose there was to go over just a review of all of the products and see if there's any questions in how they're used together. So that's kind of where I wanted to end up with, is after most of the time we'll always start with Megaspore. This is our best way of seeing how much gut damage and dysbiosis is occurring. Then that helps set the tone for how fast and how much of the Megaspore you're going to use. Usually it's 1 capsule every other day for a week, and then 1 capsule a day for a week. And then the 3rd week, you're up to the 2 recommended capsules, and you're always giving these spores at your largest meal. But if there's any GI intolerance, then you're going to cut that dose down. And that would be opening up the capsule and using a 1/2 cap. If someone is still intolerant after reducing the amount of the Megaspore, then you have the options of that HU58 or the RestoreFlor with the fewer spores, because that's usually an indication that someone's immune system is extremely damaged and not able to tolerate all 5 spores at once. So once you've started with that, if you've had someone on the total gut restoration and you've then discovered that they have some candida, it's fine to introduce the MegaMycoBalance to the protocol. If they tolerate it well with the total gut restoration, then they just titrate up on the MegaMycoBalance, starting with 1 capsule the first day, and then 2 soft gels the second day, and then 3. And then you work that up until you have 2 capsules 3 times a day. And you'll typically stay on that anti-candida product until the symptoms have resolved. And that's usually going to happen within 3 months at the very most. And the total gut restoration is also 3 months for any of the other inflammatory bowel conditions that you might have been experiencing. And then you would just let the powders run out and then maintain with Megaspor 2 to 3 times a week. Now, if you have a individual that had some upper GI, GERD, acid reflux, it's fine to start the MegaGuard in the beginning of the protocol so that they get that symptom relief. And then after a couple of days, just go ahead and start the total gut restoration and continue the MegaGuard. It should be at the end of the 3 months. They shouldn't need to use the MegaGuard either, because more times than not, the upper GI tract symptoms are caused by a dysbiosis and gut damage. So once that's been remedied, it should take care of the upper digestive tract issues as well. If they do not have a gallbladder, it is conceivable that they would continue with that MegaGuard product because it helps with that bile flow. Some individuals, will also have a type of bile. There is 2 forms of the bile, the ox or the porcine bile, and it's important to find the one that works best for that individual. And the vitamin K2, we're finding that most people are deficient in K2, especially if they've had gut dysbiotic issues, such as children that are not thriving as far as their bone density or their height, or just the strength of their nails and teeth, if they're getting a lot of cavities. All of these are pointing toward poor bone development and a deficiency in K2. So young children, and then of course menopausal women who are at risk for bone loss, men who are get a reduction in testosterone as they age. So there's a lot of different situations where vitamin K2 deficiency is very obvious, but there are situations of overuse of vitamin D that has caused a vitamin K2 deficiency, as well as several pharmaceutical drugs that also can reduce K2. So you'll see probably everybody in your practice will benefit from both the gut protocols and the vitamin K2.
So how much, if they're really depleted, how much of the vitamin K2 would you recommend? Because right now, I have some on like 180 micrograms. Is that enough, or would you do?
Yeah, so they've shown that the gut itself will use 40 to 90 micrograms. So if you're not using at least 300 micrograms, you're not going to be able to ionize that osteocalcin to the bones. So a high dose is important, and any more than 360, the body probably is not going to benefit from that. I'm going to go ahead and see if I can mute. Okay, well, the sound has stopped. So yes, the 300 micrograms is ideal. More than 360 is probably just going to be wasted. But the type of K2 is also real important. You'll see that there are different extractions out there. The Megaquinone Gold, which is the type that we use, is the most stable. So you'll see that there's other manufacturers out there saying that MK4 is the most active form, but you'll see that MK4 has a very short half-life. You would have to take it on the hour, every hour throughout the day to get the benefit from that. So the most convenient and stable and the proper dose is going to be using either the Megaquinone or the MyoMax. You can do both those capsules at the same time. You can do them while, the same time you take Megaspore. So it's very convenient. But that will give you the beneficial amount to help both the cardiology issues, the bone issues, and the soft tissue issues.
Okay.
We've seen.
I have a quick question.
Sure, go ahead.
Now it's winter time, so would it be a good idea to have, in a sense, a majority of the people taking the Megaspore throughout the winter until all the immune stuff decreases as it gets hotter?
I think that's going to be a case-by-case basis on that. Those individuals that have gone through the total gut restoration and they have resolved their gut issues, they might increase their maintenance dose of Megaspore just because you're right, to get them through cold and flu season. But some individuals, if they, the whole holiday, if they were kind of starting with Halloween and get caught up in, some of the sugar and drop their immune system, they might have to repeat their total gut restoration if they have a relapse because of the holidays. So I think you have to weigh it individual, person by person. But yes, be aware that there are challenges through the winter and through the holidays.
Okay, sounds good. Thank you.
I was going to mention what we've seen clinically with K2 is when you've got individuals that have high blood pressure, very often it's because of the calcium deposits in their vascular system. And once you use the vitamin K2 and it's removing that calcium, you're going to see their blood pressures normalize. And that's been very gratifying to see that happen. We've also seen kidney stones dissolve. Those individuals that are prone to kidney stones, we've had individuals call and say that they've seen gravel in the toilet. So that's very gratifying as well, that they don't have to pass those stones where they're too big and they would cause problems. So.
And my husband just passed a kidney stone and he has been prone to high blood pressure, but his blood pressure has gone down probably in the last 6 months, but he was on a K2 product, so.
Super, yeah.
Okay.
Can you go over the RestoreFlor again? I know the Saccharomyces does Candida support as well. Could that possibly be used instead of the MycoBalance if the patient is not tolerating the MycoBalance?
Yes, because if there's a mild case, and because yes, Saccharomyces is good. It's going to be helpful in kind of fighting yeast, and it's also changing the terrain of the gut so that it's less hospitable for pathogens such as Candida. And in the beginning, this is what we used for Candida. It just there were some individuals that didn't respond as well because they had a very serious, more serious, or it's just an individual case. We can't always predict what a person's going to respond better to. So yes, this is an option for your Candida.
And then in terms of starting a person, would it be better to start on the Megaspore and see how they do versus starting on the RestoreFlor? if I already know that they have Candida?
If I already knew they had Candida and I knew they were a sensitive individual, I would start them on the RestoreFlora. If I wasn't sure, then I would start them with the Megaspore, because Megaspore is very revealing.
Okay, so at least the first initial, hey, take the Megaspore, see how it goes. If you crash, then we're gonna back up.
Right, right. But there's
Okay.
some individuals, you know, they're too fragile to even take the risk of a crash. So I would start them conservative from the beginning.
Okay.
It may take them longer, it may take them more products, but compliance-wise, they are more apt to stick with you.
That's true.
Mm-hmm.
So when I started, I take the Megaspore, had no reactions up, you know, I was able to jump on it too really fast. And you were telling me that that could be an indication of, because of horrible antibiotic I was on, that I do have this yeast problem that's hiding under some mucin. But when I added the prebiotic, it actually started causing constipation. So I never even went bumped up to the MegaMycoBalance. I just backed off the prebiotic.
Mm-hmm. Yo.
I did also I like cut down on my serotonin, like my 5-HTP, because too much 5-HTP can cause constipation. So there has to be some gut healing, because I was able to cut back and still be able to fall asleep. So
yes, I can tell you that because everyone's microbiome is different, we have seen individuals that respond differently to the prebiotic. And it could be, you know, some people it will cause mild constipation, some people it will cause some mild diarrhea. So I think, again, it emphasizes how different everyone's microbiome is, and that, here, I'm just going to mute that so I can focus here. How different it is. But we know that if we can work through those different steps, then each product is benefiting the microbiome differently. And where you have a step that is a challenge, we have to kind of think about what could be causing that. If you're using the prebiotic, it's designed to be feeding those keystone strains. And it could be that you are so deficient in those keystone strains that it's going to take longer to get through that step. Okay, I'm gonna, Sheila, just a moment, let me get you off of unmute. Okay, go ahead.
Okay, because I was only taking half a dose of the prebiotic. I couldn't get above that.
Mm-hmm. And we've had some that will stay at a partial dose for several months. So it just means getting through whatever it is that you're working through in that step. As that microbiome is shifting, it just needs to stay at that point longer.
Okay, should I just jump onto the MegaMycoBalance though, anyways, before I even go towards the rest of the gut restore?
Yes, and that's real common too. If you know you have yeast, it interrupts so many systems in the gut. It would be worth to pulse, what we call pulsing the protocols. So you could stop the total gut restoration, start on the MegaMycoBalance, and work through if there's any die-off there. What's helpful is the IgG 2000. It will help with some intolerance, because yeast also excretes some exotoxins, and that can be very uncomfortable. And the IgG 2000, again, helps neutralize toxins and helps you get through that protocol. And the reason we'd have you stop the total gut restoration, with many situations, many individuals, they'll have some die-off of the lipopolysaccharide. Now, you might not experience that until after you get rid of that layer of candida mucus that's in your gut. And then when you bring back the total gut restoration with the Megaspore, now you might start experiencing the lipopolysaccharide, because it's now able to get to those layers of the gut that they couldn't before. And you can go back and forth, you know, with those products if the candida keeps persisting. So it may take some back and forth a couple of times until you can completely shut it out.
Okay, so don't take them necessarily to, because the Megaspore, it's like if I don't take it, I don't fall asleep, which is interesting. But I'm not getting any super reactions from taking it either.
Yeah, well, you can take them together as long as you can tolerate it. Because again, as you start moving out the mucus, you might start getting a lipopolysaccharide die-off. So then you'd be getting die-off from both the exotoxins and the lipopolysaccharide, and you just need to slow down, either slow them both down or stop one and continue with the other and pulse them. So you just need to find a way to keep going, but keeping it tolerable.
Okay. Cool. And my husband, I know, has a huge yeast problem because he's had so much antibiotics throughout his life. So I would just do kind of the same thing with him.
Yes.
He's like, when are we going to get better? I'm like, well, I'm very cautious because I don't want, we have limited funds, so I don't want to just throw money at something that's not going to work. But the other side is I don't want to just make him feel really yucky as die-off is happening.
Right. And keep in mind, especially, you know, with married couples, if one person is trying to work on yeast, they have to work with their partner because they'll transfer that back and forth. So they both do need to do the protocol.
Yes, that's typically, because that's what we did with H. pylori. We were transferring it back and forth until we worked on both at the same time. We got it under wraps. So
excellent.
Yeah. Okay, great.
So does anybody have any questions about some of the newer products? Have you had any experience yet with the MegaGuard or the Wheat Rescue product?
I don't yet.
Okay. The feedback I've gotten on the MegaGuard, I had a practitioner call in and say she had an ulcerative colitis individual that had chronic diarrhea for 6 years and started her on the MegaGuard, and after 3 days the chronic diarrhea stopped and it has not started again, and it's been 3 weeks. So that was pretty shocking, but it makes sense when we realize how toxic unconjugated bile salts can be. So if you bile salts are you know, they have have control over some of the dysbiosis in the gut, and if it's not flowing properly, the gut will become more dysbiotic, and then what bile is getting to the gut is being unconjugated, and unconjugated bile is toxic, will irritate the gut and cause diarrhea. So it had to have been, you know, that mechanism that was happening, and it was one of those cases where it was really hitting the nail on the head, that's what she needed. So you know, keep that in mind. That was kind of an extreme case, but if that's what is happening, then you should see that clear up.
So what if the stool is green? That usually means there's too much bile, right? Or does it mean that there's something else going on with the bile?
Yeah, there are some different colors that can indicate, you know, things that are happening with the bile. Sometimes it can even be a kind of orangish yellow. It just depends. But you know, those individuals that do not have a gallbladder are going to be very prone to having, you know, not enough bile. And they also have to be conscious that they don't have the control mechanism of when the bile is being put into the small intestine. So they need to keep food, flowing in their intestinal tract so that it's not dripping in the same spot, because it can be prone to causing an ulcer or a problem in that area where it's dripping. So by taking the MegaGuard, you'd keep the flow going more consistently and avoid, issues that could possibly turn into a cancerous sore.
Okay. Yeah. I have to go back and listen because I don't know what the MegaGuard has in it. So good. I'm glad you're recording this.
Yes. Yes. Yeah, and it has the artichoke that helps with the bowel flow, the licorice flavonoids that controls the H. pylori, the ginger that helps with the gastric emptying and with nausea. So it's a good combination, again, for especially those who are prone to GERD or reflux. And it's a good idea to, hopefully catch them before they would go on to a pharmaceutical PPI to control those naturally.
Yeah, those things are bad.
Mm-hmm.
Great, thank you.
You're welcome.
If somebody is on PPI, can I have them start on the MegaGuard and then just have them watch whether or not they need symptom relief with the PPI and stuff like that, and then potentially cut it off?
Yes, and that's the approach to take. It's always under their primary care person who prescribed the PPI, but generally, if you've informed them to, talk to their primary, that if the symptoms have been resolved by taking a natural product, then it just makes sense that they can wean down and eventually discontinue the pharmaceutical. But they just need to let their primary know.
Sounds good.
Oh, something else that was brought to my attention on the vitamin K2 was how it was helping with sleep. So I'm not sure the mechanism on that, except that it is very mitochondrial protective. I think those who are under mitochondrial stress may have more issues with sleep. So that might be something to focus on as well for those who, yourself or others with insomnia.
Yeah, well, I think it's probably because it's helping the nerves as well. Because you're helping absorb things like the calcium better and stuff.
Yeah, that makes sense. We did have a Microbiome Labs rep that her and her husband were seeing a fertility doctor, and after she started working with Microbiome Labs, became pregnant. So they totally believe that it was because of her and her husband taking the vitamin K2 and the Megaspore products. So if you have fertility clients, this also may be a good recommendation for them.
Well, what doesn't one of those have zinc in it?
Yes, the Megaquinone has zinc in it as well. And then, of course, that helps with sperm, but you're also helping the mitochondria of the sperm, so you're helping with sperm activity.
Okay.
Okay, well, if we've covered all the questions, I'm again very happy that we got our first breakfast club off and running. I think this will be a nice venue just to be able to discuss some of the products, different comments that your clients may be having or questions, so that we can work through some of the protocols and a chance to talk about new things that are on the horizon. And we do have several new products. I will be going to Florida December the 3rd. That's going to be the national update for Microbiome Labs. So especially after that point, I'll be able to update you on things that are happening. It is an exciting time with Microbiome Labs. They still have exponential growth that's going on. I was the third rep that was hired, and now we have about 30 employees. So it has grown significantly, which has some growing pains, as you can imagine, but fortunately the products are changing lives, and that's a really good thing. So I'll get back with you on keeping you informed on all the great things that are going on, but please don't hesitate. If there are questions that come up in the meantime, you've got my cell phone, you've got my email, reach out. Let me help you help them.
Great, thank you.
Okay,
Thank you very much.
You're welcome. Have a great day.
Bye-bye.
Bye-bye. Bye-bye.